welcome back to IPCOT TV. Today I am going to talk about a very important topic, that is heart attack. Heart attack is very common nowadays. Patient dies immediately after heart attack in heart attack cases. Almost 5% people die immediately due to heart attack. So what we have to do and how to heart attack means sudden cessation of blood flow inside the heart blood vessels. That is called heart attack. So in that conditions, what a common people can do, how the common man can identify the heart attack. Heart attack always will be associated with sudden chest pain and profuse sweating, sometimes giddiness. Sometimes the chest pain comes from the chest to throat and it can radiate to left arm. Most of the 70% of the time that will radiate to left arm only. Sometimes it can radiate to back side and very rarely to right side. So this is a radiating type of chest pain in heart attack. In case of major heart attack, the blood pressure will fall suddenly. Sometimes patient can faint. They may develop into syncope. Particularly, what we have to do in case of chest pain, the patient who are very stable, a person who is very stable, what can we do? Immediately after getting the chest pain, they can take Ecosprin 325 milligram. Immediately they can chew it or they can chew it and swallow it immediately. Then followed by clopidogrel tablet, that is a antiplatelet. They can take 4 tablets simultaneously, 75 milligram, 75 milligram, 75, 75. So 475, almost 300 milligram they can take. Along with that clopidogrel, they can take atorvastatin 80 mg or rosuvastatin 40 mg. That is, these are called statins. Immediately they can take. Before, one important point, they should not forget. Suppose if they have any bleeding disorder, if they have a recent bleeding stroke in the brain, suppose if they have bleeding ulcer, if they have underwent any major vascular, particularly aorta surgery in recent times, they should not take antiplatelets in the loading level. They have to consult the doctor immediately. Those who are not having any bleeding history, any tablets, drugs allergic to statin, they can safely take 325 milligram aspirin immediately after chest pain, and they can try to get the ECG echocardiogram. ECG is very important. However, if the ECG is not possible, they can call any local physician and tell them to assess the patient, and then followed by they can refer to higher center immediately to save their life. What we do in heart attack? In heart attack, initially we assess the patient. If the patient is not having any bleeding risk, we give antiplatelets, as I said before, loading dose clopidogrel, aspirin and statin. And one important drugs, that is called antithrombolytic drugs, antifibrinolytic drugs. The antifibrinolytic drugs are very important drugs in heart attack. If we give the drugs that can resolve the clot, and it will save the patient almost 80 to 90% without any angioplasty. Before giving the drugs also, we have to assess the patient bleeding history and ulcer history. We have mainly 3 types of thrombolytic drugs. Number 1, streptokinase is a very old thrombolytic drugs. Then number 2, urokinase, that's also first generation thrombolytic drugs. Now the third generation thrombolytic drugs, TPA, tissue plasminogen activator inhibitor, TPA. So reteplase is a very common drugs we use before the angioplasty. The reteplase drugs can be given within 2 minutes and it doesn't need more observation. So these are the very important drugs we give before the angioplasty. Particularly if it is given before 3 hours, 80 to 90% of the blood clots will get resolved immediately. Sometimes patient can avoid angioplasty if it is given in time. In thrombolytic drugs, youngsters will get maximum benefit rather than elderly people. Youngsters, those who are having very low risk factors, particularly those who are non-smoker, non-alcoholic, non-diabetes, non-dyslipidemic patients, if they develop a heart attack, particularly that is called premature heart attack, in young patients between 25 to 40 years, they will get maximum benefits with the thrombolytic drugs. These thrombolytic drugs should be used judicially to all the young patients before taking to cath lab. This will avoid 100% angioplasty and it can save their money. After giving all these drugs, antiplatelets, statins, all thrombolytic and fibrinolytic drugs, the patient is having severe continuous chest pain, if there is persistent ECG changes and if the patient's blood pressure is fluctuating, means we have to take the patient to cath lab and to do angiogram. If there is any persistent block and slow blood flow or absence of flow persist even after these attempts, we have to do immediately angioplasty to save the patient life. To save the patient life in the sense to save the myocardium, heart muscles. By saving the heart muscles, myocardium, we are saving the life of a person. So this is very important we have to follow in heart attack cases. What we do in cath lab? This is the one patient, 55 years old man, diabetes, hypertension and a smoker. He had long history of diabetes and hypertension, uncontrolled diabetes. Before coming to me, 3 days back, he developed severe chest pain. Then third day, he was referred to me by a doctor, a local physician. I assessed the patient. Patient was having moderate LV dysfunction and persistent ECG changes, and he is having persistent angina, that is called chest pain, crescendo angina. Immediately, I have given thrombolytic drugs. As I said before, loading dose of antiplatelets, clopidogrel, aspirin, statins, and I took the patient to angiogram. This is a angiography picture. You can see the left anterior artery is completely occluded at the proximal level. During the angiogram, patient developed hypotension and we managed the hypotension with inotropic drugs and vasopressor drugs. After angiography, then we passed the wire into the coronary artery, LAD, and we are not able to see the blood flow even after wiring the blood vessels. We pre-dilated the blood vessel with one balloon. Even after pre-dilatation of that balloon, there is no adequate blood flow inside the coronary artery. Finally, I took clot aspiration catheter. By that catheter, we removed the clots maximum from the occluded vessel. Finally, I put the stent in the LAD artery. The patient came up very well. So patient chest pain relieved, blood pressure has come up, and patient was discharged on third day without any discomfort, and the LV function, heart dysfunction, has improved dramatically after angioplasty. And the following medications are very important. He cannot skip any medication, and patient's follow-up also very important to prevent and preserve the stent patency, and further heart attack in future should be prevented by proper follow-up and properly adjusting the medicine and keeping the risk factors under control. Treating the diabetes and hypertension effectively will have maximum benefit to the patient life. Thank you very much for watching IPCOT TV. Subscribe IPCOT TV for more information. Any queries will be answered in an effective way. Thank you very much.